are people in the waiting room, maybe you can assist them, or maybe I should. Okay, so according to the changes that we've made, I'm going to give my short presentation now. And the topic is regarding short mindfulness-based interventions for seniors, effect on attitudes for treatment and emotional distress in particular. So I would like to start. When we look at psychological aging, we know that the aging population suffers from physical, cognitive, and social losses and emotional distress more than any other age group. But nevertheless, this period of life is also of greatest potential for psychological well-being. When we look at mindfulness, the definition I chose is that mindfulness is the awareness that emerges through paying attention non-judgmentally in the present moment. Mindfulness-based interventions, MBI, have shown to improve emotional distress and also cognition. Standard MBI courses include long sessions of 2.5 hours and are too demanding for most seniors. So there is a special need to adjust MBI for seniors, and we call it MBIS, Mindfulness-Based Interventions for Seniors. So the method we applied is an MBIS course, I would say what it is, for either 8 or 4 weeks. The course is adjusted for seniors, 8 sessions of only half an hour sessions based on MBSR and MBCT. In this study, we delivered it either twice a week for 4 weeks or once a week for 8 weeks. So either ways, we had 8 sessions. They were either delivered across 8 weeks or within 4 weeks. We had 31 participants, seniors, aged 65 and above, who were sampled from the community in Israel, divided for either 4 weeks of MBIS, 10 participants, or 8 weeks of MBIS. Finally, we only ended with 5 participants, and care as usual control. We used cognitive measures of the mini-mental state examination and the Simon task, and emotional examinations of the Beck Depression Inventory and the Psychological Health Questionnaire, measuring depressive symptoms. We also used the 5-facet mindfulness questionnaire to assess changes in mindfulness. So I just want to say something about the Simon task that we used. The Simon task is a very common cognitive task in which participants are asked to reply to a colored circle that can appear either to the right or to the left of the screen, or also at the top or bottom of the vertical center of the screen. And they have instructions that ask that if it's blue or yellow, they would respond with the left key. If it's green or red, they would respond with the right key. And we see compatibility effects here. You can see on the y-axis reaction times in milliseconds, and at the left, the young adults group, at the right, the old adults group. And we see that we have a compatibility effect, but for the older adults, there is a bigger interference. The incompatible trials interfere more and make older adults respond slower. So there is a cognitive effect of inhibition that we see in old age. The results of our study showed that first, for mindfulness skills, we looked at all 5 facets, but awareness, non-judge, and non-react were the facets that had significant change from time 1 in blue to time 2 in orange. Looking at depressive symptoms, this is the PHQ-9 here. We see on the y-axis the score of the scale. In blue, we see before the intervention, before the MBIS, and on orange, we see after the intervention. And as you see on the left, in the x-axis, the control group showed no change, definitely not significant change in depressive symptoms, while the intervention groups, both MBIS, either 8 weeks or 4 weeks groups, showed any significant improvement in depressive symptoms following the intervention. This is a very complicated graph. I would not go into all details, but I would just say that for the cognitive measure, we saw that the control group here on the right, this is for the Simon task, looked just the same before at time 1 or after at time 2. And the MBIS for 4 weeks only also looked quite the same, but only the 8 weeks group has gained cognitive effects, and some of the sequential dependencies, the effects, the long-term effects or the trial-by-trial effects of cognitive inhibition improved for this group. So if I summarize the results, I would say that MBIS improved in mindfulness facets of reactivity, awareness, and judging, and also depressive and cognitive aspects, but specifically both groups improved depressive symptoms, but only the longer group improved cognitive aspects. So when we try to understand these results, we see that we have a positive impact of MBIS on the reality experience, and even the surprising finding that non-reactivity that should have increased, they should have been less reactive to the environment, but it was decreased. So they were more reactive. It was a surprise, but it is actually a positive finding, because when we talked to the participants, we saw that they felt they understand the world. They felt that nothing is going across time and they don't find the attention for it. They felt more attentive, they felt more alive, and therefore they felt they can be more responsive. So they were more reactive, but their depressive symptoms went down, so their psychological well-being hence increased. The depressive symptoms were positively impacted, as I said, and it does appear that cognitive change requires more time. And since it only improved at the 8-week MBIS, we understand that cognitive processes need more time to change. These short interventions are suitable and effective for seniors, and they should be applied in various facilities. I want to say that the instructors were not professional mindfulness instructors. They were MA students in their second master year. So this is something, and can share this knowledge and use these protocols in nursing homes, retirement communities, daycare centers, everywhere possible to allow more seniors to join this MBIS. So I want to thank you, and I want to say, just to finish, that as Michelangelo created Moses at his latest life, later adulthood is a time for growth and finding more meaning in our life and enjoying our better psychological well-being. Thank you very much.
Any questions? So yeah, thank you for your presentation, Doctor.
Thank you.